Welcome to another episode of the Face podcast. Today, I'm interviewing specialist plastic surgeon, Dr. Peter Callan. Based in Geelong, he has 25 years experience and specialises in facelifts, eyelid surgery and rhinoplasties. I welcome Dr. Peter Callan. It's interesting once people know they're on camera it's like being on stage, right?
Yeah, I guess, yeah. Yeah, I don't mind being on stage.
No, you're used to it though.
Yeah.
It's been a long time. Yeah.
Yeah, well, I did it when I was at school.
Did you?
Yeah.
Really? Public speaking?
Well, no, I did a lot of stage shows when I was at school.
Did you? Acting? Really?
I wasn't very good at it, but I had the...
Where did you go to school?
I went to St. Joey's in Geelong, where I did a fair bit when I was like 7, 8 and 9. Mm-hmm. And then we moved to Melbourne and I was at Xavier.
Oh, were you really?
And I did all the Gilbert and Sullivan and stuff.
Wow. So. Well, I was told that you wanted to be a pilot. Is that true?
I told you that. I did want to be a pilot. I did want to be a pilot at school, but I'm asthmatic and they all told me you would never get in. So I had to sort of, I did because I love flying and I love planes and stuff like that.
Did you ever get your pilot's license?
Yeah. I got my pilot's license, yeah. But I haven't flown for years now.
Okay. So how did you end up a specialist plastic surgeon, Peter Callan?
How did I end up as a specialist plastic surgeon? I went through medicine and I worked with a lot of influential characters, as you do. Mm-hmm. And it probably, when I went to Geelong on my first rotation in surgery, I ran into plastic surgeon Daryl Nam and I was associated with Daryl. Now, Daryl was an excellent plastic surgeon in Geelong, has retired now, but still mighty fit. And also when I was there, Professor Wayne Morrison, who's from St. Vincent's, came down. They had a massive influence in my career. And at the time, I was also, strangely enough, I'd been doing ENT surgery as well as a resident with Jack Kennedy, who's an ENT surgeon at St. Vincent's. And at the time, I was deciding what to do. And I spent a bit of time when I went to St. V's after Geelong with the plastic surgeons there, and I really liked it, and they encouraged me, so I applied, and I was fortunate enough to get in back in 1990 was my first year. So I trained, first of all, in Melbourne, and then I went to Brisbane, and then I came back to Melbourne, and then I went overseas for a few years and did some fellowships in Scotland, in England, then to Canada, and then to the US, and came back and set up my practice in 1995 in Geelong. So,
wow.
Yeah.
So you've got 25 years experience and you specialise in facelifts and rhinoplasty and eyelids. How has your practice evolved since 1995? I started off being in a regional place because I'm from Geelong. I'm originally from Geelong and then set up practice in Geelong. I love Geelong. I was more general in those days. You had to really I was trying to do everything, and you come back and you want to service as many people as you can. As the years went on, there were certain things I liked more and more and more. And then I developed an interest probably in about 2008, 2009. I thought rhinoplasty is a great operation and facelift is a great operation. I've really got to get good at these because there weren't that many people just specialising in those things. There was a lot of us who were doing them, but I've really got to get good at these. So I went overseas. I went to a lot of courses. I made friends with as many rhinoplasty surgeons as I could and as many facelift surgeons as I could. I was doing anatomy workshops for injectables, which you may remember that I've done about 100. I bought one of those. I bought one of those workshops.
Over 100 of those over the years, and then Brian Mendelsohn invited me to be on the faculty of his MAFAC, the Melbourne Advanced Facial Anatomy course, which is now called the Mendelsohn Advanced Facial Anatomy course. So I was on the faculty of that, and I just developed my interest and kept on trying to get as good as I could at both of those operations over the years, which of course includes the eyelids as well. So that went on, and then in about 2018, I just said, right, that's it. I'm just exclusively doing that now. So.
I want to talk about aging firstly. You know, why do some people age better than other people?
That's the million-dollar question, isn't it? There are certain things that we have no control of, and there are certain things that we do have control over. And the things that you don't have control over, obviously, your genetics. And people tend to age like their parents. They also tend to age like their siblings, which is also aging like their parents. And there are certain things that will influence the way people age. And the things that you have control over are your exposure to the sun. Mm-hmm. And obviously everybody needs some exposure to the sun, but not excessively so.
Sure.
And while they may look great when they're young, which is a lot of the problems, is that we're great when we're young and we're fairly resilient with everything, but it does catch up with you because the lag time's 20 to 25 years on most of these things. Smoking is another thing. And then, as you well know, everything in your life, general well-being, nutrition, exercise, you know, your mental state, all of these things add up.
I think stress is a huge component.
And certainly we see that, don't we? People who have been through something terrible and then they age. The other thing is I think people do tend to age in a stepwise fashion. Like you don't wake up every morning thinking you look worse than you did the day before, do you? Right. But then there are certain times in your life where you look and you go, whoa.
Yes.
What happened? What happened? And so I think we have a program inbuilt that we see, okay, we're looking roughly the same, but then suddenly we see something that we didn't see before. It's obviously always been there. You probably looked the same the day before. But suddenly it's the straw that breaks the camel's back. And then you age a bit. And then you go on like that for a while and then you age a bit more. I was reading the other day that there are two big aging points in your life, 44 and 60. I don't know whether that's true or not. But
well, I think that for women, you know, that I see in my practice that the perimenopause period it's an all of a sudden moment.
Yeah.
You know, do you find that?
I think I don't know what happens or when people do. A lot of the people that see me, they've been thinking about it for a long time. But then there are people who come in and say, you know, 6 months ago I saw this changed. So yeah, I don't know whether it's related to menopause, whether it's related to other things, weight changes.
Sure.
But I think everybody ages inevitably. Nobody looks at 60 like they did at 20, but they don't see themselves going through that phase in a gradual manner. They see themselves going through it in a stepwise manner.
Are you seeing the effects on the face from the increase in use of weight loss drugs?
I know there's a lot of talk about that. I haven't had that as yet. So they've been going on for those drugs have been around for probably a couple of years now, or been popular for a couple of years now. I do see weight loss patients for facial rejuvenation surgery because, you know, it's the old story is that volume in the face. It's like if you blow up a balloon and then you take air out of it, there'll be a certain stage where the balloon will start to sag. And that's certainly the case with the face. Some people are lucky though. Some people are resilient. Their faces will shrink down and it's amazing. It's the same with their body. It's like after pregnancy, some women will shrink down and others, the skin won't shrink up. So some people have this elastic skin that will shrink up, but others need some assistance to perhaps get that skin back to draping the way it used to.
In terms of facelift surgery, that's something you do specialise in. What would be the most common age you're seeing patients in 2024?
It's a good question. We've been looking at this. We see that the peak range for facelift is between 45 and 65, I think. That's not to say we don't see patients outside that range, but under 45, it's not that common.
Sure.
Not that common. Over 65, it's relatively common, but probably the sweet spot somewhere between 50 and 60, I think, where the majority of patients see themselves as needing some assistance or see something they want to do. And a lot of them have been thinking about it for a long time. Why it's that age, I'm not sure. I think people are still working, people are still out and about.
Yes.
And there is a certain age where we become content and don't care, I guess. But I don't think you should ever not care but it's a question of what you care about. So,
do you think that there's an age that's a little bit too old? I nursed a lady when I was working for Dr. Mendelsohn, and I think she was around 66, and she hadn't been quite so upfront with her family. And we found post-operatively that she was a little bit stressed and didn't handle it maybe as well mentally. Do you think that that's an individual thing, or do you think that there's a time where maybe you should leave that decision behind?
well, I think 66 is pretty young, really.
Yes, no, I do too.
There are 66-year-olds that are young, and there are 66-year-olds that are old. I did a woman last year who was 79 for her 80th birthday.
Wow.
And she loved it. She flew through it. And I think the biggest factor in getting a really good facelift is having good skin. That's the thing. If people have got good skin, the result of facelift is better because the skin has a quality that enables it to drape beautifully. When your skin hasn't been looked after, or you're just unfortunate genetically, or you've been a heavy smoker or something like that, there are certain qualities of the skin. A facelift can't affect the skin. It won't affect the skin. There are other things you have to do. You need to see possibly people like you, or dermatologists as well, people who can do resurfacing procedures and things like that. Because if you look at people and their age, skin quality is a much bigger determinant of how young people look than anything else. Like, I look at my mother, for instance, who's still going strong, and she's 87, 88, whatever. Sorry, Mum, letting that out. But she always protected her skin from the sun, and her skin is magnificent. And consequence of that is she looks better than looks much younger than she is.
In your facelift procedures, are you doing any resurfacing, or did you used to do that in the past?
I do peels.
Okay. And
I have a few connections of people that we send people to for laser resurfacing and other types of resurfacing, and good looking, able to get their skin in looking good, really. So
before the surgery?
Before or after, it depends. People have certain deadlines that they're able to meet, and that they're able to. You need some time to recover from a facelift. You may need some time to recover from resurfacing, but on the whole, you probably don't need as much time. So if people are looking at maybe having something done in 6 months because they've got a window of opportunity, you could use that 6 months to look after the skin. If they don't, if they say, look, my window's in the next 2 months or something like that, then you may say, well, let's do the skin treatments after. It'd be nice to do it before. I think it'd be nice to get it all done and dusted before. But all of these things are ongoing maintenance, aren't they? You can't just say, well, on your way, you're done. We all need maintenance in some way, shape or form.
Absolutely. I had a patient recently return to my practice post-facelift. She would be 5 weeks post-operatively. She looks fantastic. When would you be advising your patients that they could go back to work?
So some people will go back to work after 2 weeks. Now, that's early. Women have the advantage of makeup, that they can cover things, and hair, correct. And there was a big advantage with masks of late if there was any issues.
Yes.
Hair and glasses make a massive difference to the way, just ordinary glasses, just like these, clear glasses, because there can be a little bit of swelling and so forth. 2 weeks is early though. Men have the advantage of their bruises go a little bit more quickly than women. They seem to recover a little bit more quickly because I don't know why, but the bruises seem to disappear a bit more quickly. Most women, after 2 weeks, a lot of it's gone, but it can take, I generally say it depends on whether you want people to know or not. I would always take 2, but I think a lot of people need 3, and I think most people are right after 3. But obviously, if there's an issue, things don't always go smoothly. It may take a little bit longer. It probably, however, takes, I think, after a facelift, and it depends on the type of facelift you're having, I guess, but it probably takes 3 months to get back to being totally undetectable by a perceptive eye. But most people don't see that. As long as you look relatively normal, people don't notice it.
What about scarring? So Is it common to need a scar revision, 12 months later, or how does the scar process work?
So all facelifts involve scarring of some sort. And the question is how extensive that scarring is and where it's positioned and whether you can see it. As a rule, scarring to me, and I used to worry a lot about scars, it's much less of an issue than I thought. People don't look for scars unless you look strange.
Sure.
Right? Then they may say, wait a minute, what's going on here? So as long as the person looks totally normal, people aren't expecting to see them. The other thing is I'm a plastic surgeon, and if I perceive that somebody might have had a facelift, I will try to position myself to see that scar. That is very difficult to do.
Okay.
So you don't normally stand with someone to the side of you.
Sure.
Because the scars are in front of the ear, behind the ear, and sometimes across the hairline of the forehead. Extremely difficult to see in most people and imperceptible in just about everybody, as long as they look normal and you're not looking for it. And that's the aim of the whole procedure.
When I started my practice 13 years ago, it was very popular to have surgical procedures in Thailand. Now we're seeing the increase in Turkey. Are you seeing any patients coming back needing help from things that maybe haven't gone right?
I don't see that many, and it's probably because I'm in Geelong.
Sure.
I don't think I get... I know a few of my colleagues see some issues. Don't get me wrong. I mean, some of the best surgeons in the world are in Turkey, right? The question is, some of the best may be there, but also people who need the work from elsewhere may be there too, and not everybody is great. So there may be some issues. I think the biggest thing is you've got to find somebody who can do the work. But the second thing is you want to have someone to look after you afterwards.
Exactly.
And if you're just flying back, then you've got to find someone here who'll look after you. Now, none of us mind covering our colleagues when they're away.
Of course.
But if we're covering work from overseas, that's a little bit more difficult because then you're stuck with that. So while we're happy to help, it's probably not ideal. I would rather be around the person who operated on me so as I can annoy them when I need to.
I think for me, if I was to have something done overseas, my concern would be that, I've done a lot of traveling in my life, and any sort of long haul flight, whether it's from Europe or New York, it's a bit of an ordeal anyway when you're at full health. Coming home from a major body surgery or a surgical procedure and not being 100%, that would probably deter me.
I think there's a bit to that. The problem with, the thing that would terrify me about it is DVT.
Yes.
You're on an aeroplane for, however long, 14, 15, 16 hours. Then you're on the operating table for between 4 and 6 hours. And then you're on an aeroplane again for 13 to 14 hours. That's not ideal for anybody. But look, people do it successfully. So the trouble is at the moment we're competing a little bit with our hands tied behind our back because the restrictions on our advertising and so forth are so difficult that people are seeing everything from overseas
and nothing
unfettered, nothing from here.
Yes.
So the main people who are influencing people are influencers and people from overseas.
They are.
And then we can't enter that discussion at all. So it makes it extremely difficult for us to be able to educate people the way we would like to.
Because the Australian consumer isn't able to see any information from our, plastic surgeons or, medical arena in Australia, correct?
Well, no, they can see some, but it's highly regulated as to what you can say. Like, for instance, you can't ascribe a benefit to any cosmetic treatment.
Sure. So you can't say rejuvenation or
any of those words, they're
or
all
improvement or
no.
Yes.
No, it is a service and people are presumably seeking that service to get that result. So it's very difficult. It makes it very difficult.
Yeah, it does. We're seeing the words undetectable era, where Christina Aguilera, you may have seen in the media recently, has had such a transformation. She looks like she's in her 20s again. Lindsay Lohan's another one. Is this because I mean, celebrities in Hollywood, for example, have access to, top people. Are they just having the procedures younger? Is that why, we're seeing it as undetectable?
I guess you've got to be careful at what you're seeing and whether it's truth. A lot of AI is involved in a lot of the photography and videos these days. So are they really like that, or is that something we're aspiring to, or is it not? I guess there's been a change, and there is a bit more normality associated with maintaining yourself these days and having things done. The stigma associated with these things is nowhere near as great as it used to be. But I think the reason for that is partially because we're so much better at it now than we used to be. So we can give somebody, make somebody look totally like themselves, the way they were, the way they are, the way they should be, the way they used to look, sort of, without any stigma of surgery or even other or non-surgical treatments. So we're so much better at it now. So the question is, people in Hollywood have sought out a range of surgeons, haven't they, over the years? And not all of them have been successful in that. Well,
no, because we still see to this day some really terrible work.
And it's unfortunate that you see that. And of course, this is when people worry about having that sort of thing done, they look at themselves in the light of that. In other words, people don't know often who's had good work done because they look normal.
Exactly.
And therefore, unless they come out and tell you, like Christina Aguilera does, you won't know unless somebody with a great eye sees them. What they do pick up on is people who have had bad work done.
They do.
Anybody can see that. We can all see that. And this is the fear that people have, is that they're going to finish up like that.
Well, the fear is that you will look strange, and the person that is brought up the most is the Jocelyn Wildenstein, that cat woman, because she has sort of been the person everyone looks at for the bad plastic surgery because she wanted to look like a cat.
Yeah, but she also involved other people in that. And that's the disturbing thing, is that she wanted to look like that, but there was somebody prepared to do that, which I find that bad. I don't think anybody should get involved in that. They argue, the people who want to look different argue, well, we need to see somebody safe. You need to embrace this and all that sort of stuff. Well, maybe some do. I personally don't believe in that, and I wouldn't do it.
No.
And I think there's been 2 people involved in that, or probably more, in the people who tend to keep going and don't stop and have bad work done. So there's 2 sides to the story.
But I think that's one of the most common things I hear in a non-surgical sense is women express that their husbands do not want them to get any treatments.
Absolutely.
And the fear is that they will look strange.
Particularly face.
Yes.
Particularly face.
Yes.
And that's true. They're scared because they only know what they see.
And they only can recognise the bad work.
Correct.
Yes.
They don't know about the good work. Now, you can often allay that fear by having people look at your website or showing them befores and afters in the results. And we're very grateful to people who allow us to use their photographs in that way, because without that, it's very difficult. A picture says everything. I can say what I like to a patient, but if I can show them, it makes a massive difference. And if you can show the patient and their loved ones, this is the work we do, de-escalates the situation. People feel much more comfortable knowing that at the end of it, this is what to expect. And that these people do look like themselves. They've just had the disharmonies taken away. It's a change, but it's a change that has removed anything that, mainly the things that they don't like. But most people can't recognise this. Most people can't recognise what they don't like about themselves or the parts they want you to do something about, because they only know a few things. particularly, I mean, you'd know this as in your practice, is that most people only know about crow's feet.
Yes.
Right? Or the 11s.
Yes.
All right? Or lips or something like that. But they don't know about the gestalt, which is my favorite word, which is looking at the whole. It's the entirety of the person that people look at, and the eyes particularly. When we look at somebody, we look at their eyes. You can't change the ways people's eyes are, because if you do, you change their entire person. So their eyes, shape-wise, must look the same. I mean, sure, they may have some excess skin that's removed or some contours that are changed, but as long as their eyes look like them, then they look like them. And people don't notice anything. So
I want to talk about eyes for a minute, because eyes is, such a hot topic. There's puffy eyes and there's hollow eyes. And if a person was a good candidate for a lower lid blepharoplasty, I mean, I see so many patients come to me for help in a non-surgical sense, and they have puffy eyes, and it's not appropriate for what I do.
No.
So talk us through that.
So lower lid blepharoplasty, and for most people need a lower lid blepharoplasty for one of two reasons. One is they've got too much skin there. In other words, it looks, the skin's hanging down, or they've got some swelling there. But the swelling can be due to multiple things. As a rule, it's due to the lower lid fat coming out. And it's a little bit complicated. I don't want to go into it too much, but I guess the orbit, the orbit is holds the eye, which is the bone, and the eyeball floats in the middle of that, and then it moves around, and it floats in a sea of fat. As we get older, the support of that fat, there's a ligament under that holds the eye up, drops a little bit, so the eye sinks a little bit. It doesn't affect your vision or anything. But as it sinks, it pushes that fat out. So you get little puffy bags, which are usually worse in the morning.
Yes.
Because when you get out of bed, there's a bit of swelling in them, and they tend to subside as the day goes on. As that fat goes out, the fat in the upper eyelid often gets retracted back because it's a closed system. There's only so much volume in there, and if it goes out here, it has to get sucked in there. And you can do this in front of a mirror. If you stand in front of a mirror and have a look and you've got these fat bags in your lower eyes and you push on them, you'll see that the fat comes out in your upper eyelid. Now, the tendency in the old days was with lower eyelids was to take this fat out because
all of it.
It was some of it,
Yeah.
to stop it sticking out, which sort of worked.
Yeah.
But the trouble is, what people weren't looking at was the upper eyelid was hollowing out because they were taking fat out of that system. So it was getting hollower and hollower. And the same with the upper eyelids is that people were taking fat out. We tend to think now that most people don't make too much excess fat there as they get older. All we've got to do is just push it back in.
Sure.
And it rejuvenates both the upper and the lower eyelids if you push it in the lower eyelid.
So you're sewing it down.
Yeah, what holds it in, as you get older, it's complex why this happens. But the ligament that holds the eyeball up slackens off a little bit, so the eyeball sinks a little bit. The cheeks start to descend a little bit, so the muscle that's holding the fat in, like this, over your eye, is getting stretched. And we don't make new muscles, so these fibers are further apart, so they don't have the power that they did. So one of the things about a facelift is when you lift the cheek back up and you bring these fibers, muscle fibers back together, and they get more powerful, and it will hold that fat in. The other consequence of that is and anybody who's been injecting botulinum toxin for long enough will know that if they wander too far down here sometimes, you will create somebody to have a fat bag in the lower eyelid and they go, I get puffy after my toxin. Why is that? And the reason is you've slackened off that muscle because that muscle, you're relying on it to hold the fat in. So you can see that there are multiple reasons why that fat might come out. The eyeball descends, the muscle gets a little bit weaker, it gets more exposed because the fat drops down as well, and then we see it. So what we do, the complete solution for a lower eyelid is push the fat back in, tighten up the membrane that's holding it back, lift the cheek up, and then you get the maximum result. But lifting the cheek up normally involves a facelift.
Okay.
So it's sort of, while the upper eyelids can be done independently, often with the brow because the forehead lines, they become too much. The lower eyelids is normally a reflection of the face. So the complete solution for the lower eyelids is usually a facelift, which shocks people when they come in and they say, I just want my lower eyelids done. But if you want the complete solution, it's normally reflecting your face, because if they have that, they'll normally have this, they'll normally have jowl and all that sort of thing, because things are starting to descend. So children, their cheeks are high, their muscles strong. You don't see any of that.
Talk about the patient satisfaction after a facelift.
It's a great journey, the facelift, right? So my staff love the facelift more than they love anything, because they love seeing people come back.
Sure.
But initially, of course, people go through a stage of not looking like themselves for a few days, probably a week or two. But then they start to get better. And then as time goes on, 2-3 weeks, they start to see it all. They see their neck's improved. They see the jowls are gone. They see this marionette line has changed. So has the nasolabial fold. The cheeks have moved up. The eyes are a little bit brighter. And all those disharmonies that they had before have started to go away, or at least not look the way they did before. And it's a great journey to follow somebody with, but there's a bit of hand-holding involved initially.
Sure. I've done that. That was my job. So when I worked for Dr. Mendelson,
with Brian, yes.
I'd followed them all the way.
Yeah.
And then you would see them back at the 4-month mark, and then again at the 12-month mark. And, you got to know that person.
Yeah, I think 3 months is great. I think 1 year is great. 2 years, great. Everybody starts aging again, of course. Yeah. But, those first few years, it's a great experience to take them with. I mean, some people do go through, we always warn people that there may be a little bit of reactive depression in that first week or so. What have I done?
Sure.
All of this sort of stuff. But once they start to see themselves again, which takes about 1 to 2 weeks, that also usually disappears pretty quickly.
I talk to people all day, every day in my practice, and in past experience I had come across, patients that have had the facelift, their sister's not happy for them, their husband's been a bit jealous. Have you found that in your experience?
That's a great question, because this perception of what other people think is a worry for people.
Huge.
The first thing is, of course, and you and I both know this, is that people should only do things for themselves. It's very important that they're doing it for the right motivation and that they see somebody who knows what they're doing. Then the big worry they have is, how are my family and colleagues going to react? Family usually more important, and they feel that everybody is going to judge them. Now, in my experience, that is more of a threat than a reality. As a rule, it never happens.
Well, that's great.
Never happens. They're worried about it, and if they tell them beforehand, yes, there is that worry, because they do get that judgment.
Sure.
That's going to happen. But if they go ahead, as a rule, it evaporates. Once they see that they haven't been changed in that preconceived idea that they had by looking at the media, and they see that this is still my sister, this is still my daughter, this is still my mother, my husband, my brother, whatever. Once they see that they still them, they embrace it. They love it.
With men and women, throughout history, men have been able or allowed, to age. Women, not so much kindness for women in that arena. How are you finding in your practice, is there an increase in male patients?
I think it's probably fairly static over the years. Women way outnumber the men. But there's a few reasons for that. Men, as a rule, carry a lot of these things. I don't know whether it's the right thing to say better, but a lot of men look better as they get older for some reason.
It's just so unfair.
It's terribly unfair.
I can't bear it.
It is terribly unfair, but a lot of them do.
Hair,
I can't explain it. it's the concept of what looks good to people and what's beautiful. And despite what people say, it's inbuilt within us. We know what looks good. We don't need people to tell us. As a rule, we know it looks good, we accept it, or we know what doesn't look good. If that wasn't the case, if it wasn't the case that there wasn't beauty in the world, then there would be no such thing as art galleries.
Sure.
If everything is beautiful, what would you put in art? You'd put everything in an art gallery. But there are certain things that transcend what we see as normal or what we see as beautiful. And, you know, people are beautiful in a number of different ways, obviously, but physical appearance is part of the way we are. You've also got to look genuine, right? So you've got to look genuine. You've got to look confident. All of these things help in the way we perceive somebody. So there's their beauty, but there's also their genuineness and their confidence, which goes. And Steve Dayan wrote a great paper about that. And I think if you, it just shows that, yeah, beauty is multifactorial. So looking at someone from across the street, you can see a few of these things, but they have to look genuine. They have to look confident. It may change when you speak to them. You know, why is it that men have this ability to, I don't know, it's ability. It's nothing they've done really.
They haven't done anything.
No, they haven't done anything. It's just that, you know, somebody told me that men shave every day and they they do a dermaplane themselves every day. That may help their skin. Their skin is usually thicker.
It is.
So they don't get that fine, crepey skin as much as the women do, but they do. And certain men don't age as well as they would like, and they do seek our services, and certain men seek your services for other reasons. You know, weight's got a bit to do with it as well. You know, volume in the face does change with time. It's probably not as big a factor as it used to be thought to be. Everybody says, people deflate in the face as they get on. And Brian Mendelsohn and Chin Ho Wong wrote a paper a long time ago probably about 10 years ago about skeleton aging.
Yes.
And as the age, the bone shrinks a little bit.
Yes.
And Val Lambros wrote about the soft tissues. And probably the soft tissues are more significant, particularly in the perioral area, around the mouth, around the base of the nose. These areas do age a lot. Probably more volume is lost here than is lost here. And then Richard Huggins recently did CTs on 400 heads and has some different ideas about what aging has done to people as far as their bones are concerned. And maybe the bone isn't as much as we thought it was.
Oh, I'm really interested to see that.
Well, that hasn't been published yet, but it's in the pipeline. So I'll be interested to see it too. I've only just heard about it in the last week, so we'll have to see what happens there.
Because men are not immune to also looking strange after plastic surgery.
Oh,
you know,
absolutely.
Like Mickey Rourke, and I think what you were discussing before about the blepharoplasty, someone like Kenny Rogers, they've obviously taken too much away from his eyes.
He's a classic example of terrible surgery.
Sure.
Where his character was completely changed.
Yes.
And fullness in the upper eyelid is a sign of beauty. Now, if you look at models,
yes,
as a rule, there are two types around the eyes, and one is the full eyelid and the other is the hollow eyelid. Now, the hollow eyelid will probably look that way for ages, but the fuller eyelid is an attractive feature. They're probably going to need something done about it as the years go on, because they're the people where the skin will start to encroach. The hollow eyelid probably won't need much done at all. But people have various things, but they changed Kenny Rogers from having a full face into looking gaunt and having hollow eyes, and it was terrible. It was terrible.
In terms of that, you discussed before that the men do have thicker skin. Do you think that their facelift results is as positive as a woman's?
I think, definitely. I think it's as good, really. I think it's probably very similar. I mean, we can't do the same thing to everybody. It brings me on to the point about, you see, the best surgeons, I think, who do these sorts of things don't give the patients a lot of choice. They don't compromise their result because the patient's done a bit of a Google search on what they want.
Okay.
Right. The good surgeons who are good at this work, they have a way of doing it that they've modified over the years, and to get the best results. And good surgeons are always improving, right? So they're always, and over the years, they've developed a technique that's taken a long time to develop. And every patient gets the same recipe, but we may adjust it a little bit. Obviously, you may need to do a little bit more than a little bit there, than maybe a little bit less there and a little bit more there. So with the men, we won't, obviously, men look good with low brows. We don't want to do much to that.
Sure.
And women look good with flat brows as a rule, maybe a small arch at the side in some, but nobody looks good with really high brows, right? So the whole idea is to make everybody look balanced. So we do change the operation in the amount of work we do in certain areas, but overall the operation is very similar. So I think you've got to be careful when patients ring up and ask for certain things. And I'm sure you've had this before where they want the latest and greatest.
I mean, we went through a phase where every person, particularly in the 30s, were bringing in a photo of Bella Hadid.
Yeah.
And I mean, Bella Hadid is a very beautiful woman. And the reason she's walking a catwalk in Milan is because she's probably 2% of the population that looks that way. So,
That's right.
Relaying,
That's why she's doing it.
Exactly.
Exactly.
And that's why she's so famous and in the media because of her beauty. But relaying that to a patient that this isn't you and we can't achieve this, specifically with a non-surgical procedure. How do you handle patient expectation?
Patient expectation is everything. And that is the hardest thing to gauge and to work out. The fortunate thing for most of us who are doing this work is that most patients are reasonable and they understand where they're going and they understand what the effect of what your work is. But the thing about a facelift is it's multiple procedures. It's not just one thing. It involves everything. And I think if you don't do it globally, people start to look strange. So you have to do everything because if you don't do everything that's out of harmony, or if you do something that's not out of harmony and leave something that is out of harmony, people tend to look more strange, which is worse than they did. So you have to do everything, maybe a little bit in some areas and a lot in other areas. Some people don't need their eyes done. Some people don't need as much done in the brow or something like that. But I think you've got to do everything to give somebody a global rejuvenation because then they look totally normal. You can't just do parts when you're doing a facelift. And that's why it's multiple procedures. So how do you handle a person's expectations? People come in and say, I only want this done, right? And you go, well, the problem is if I only do this, in order to do that, I have to do that. And you're going to be left with this. And then if I remove that, you're going to be left with this. So there's a price to pay for everything you do, and you have to fade out everything so that they look normal at the end. So once people come to that realization that this is what I'm going to get and this is how it's going to work, and they trust you in what you do, they're the best patients. The patients who try to modify your procedure, they're one of two types. One where you say, listen, I don't think it's going to work because of these things. And if they go, okay, I understand that, that's fair enough. If they argue that point and they're going to compromise what you do, then their expectations are never going to be met. Nobody ever thanks you for everybody wants an underdone operation, right? But nobody ever thanks you for doing an underdone operation. They go, what about this?
Yes.
Right?
No,
why didn't you do that? So you have to do the operation properly.
Yes.
It's not overdone. It's not underdone because people are scared of changing the way they look.
Yes.
But if you can assure them they will look the same and it's unlikely anybody will notice. It's a funny thing. Some people are disappointed when people don't notice.
Oh, absolutely.
Right? And I go, you want not understand that's a good thing because you still are you.
Well, if they notice, that means you look strange.
Exactly.
Often.
That's exactly right. They would notice if you put a before picture up beside you and you walked around like that.
Yes.
Right? Nobody does that.
No.
But they would. But as you can see the difference. with the before. So the only way you should be able to notice a difference is if you have a before and after photograph up.
Sure.
That's the only way you should be able to notice a difference. Some people have to be very perceptive on this. With rhinoplasty, you could have a Jimmy Durante nose and change it into a perfect nose and most people would not notice.
No.
As long as it looks like it fits their face and it was always there and it doesn't look operated on, then it's them. And people don't notice these things. Change the eyes, different story. Different story.
You've got 25 years experience and one of your specialties is rhinoplasties. How much patient satisfaction is there with this procedure?
That's a great operation as well. One of the things, I spoke last weekend at the maxillofacial conference and I talked about contour as an important thing. With facelift, if you don't have an underlying good contour, then it's very difficult to get a good result. So I often involve one of my maxillofacial colleagues in doing some of this work to change contours, and then people look great. Now, the thing about the nose is that you can change the contour.
Sure.
Right? So in facelift, as a rule, all we're doing is changing the amount of drape or the amount of hang. But with a nose, you can change contour. Therefore, you can really make a change to the way somebody is perceived and the way they perceive themselves. And the good thing is that a nose that looks good usually functions well also. So that's what we're looking for. We want a nose that looks normal. In other words, people look past it. They look at their eyes. They don't notice the nose. Functions well, looks like it fits their face and sort of stays that way and fits their ethnicity and all that sort of thing. So
there has been such a swinging pendulum of really overdone noses and more natural noses. Your aesthetic, I'm assuming, would be more natural. How do you handle the patients that want something more extreme?
I tell them that I don't do it.
Okay.
I'm not it's the same with facelift. Facelift noses. There's restoration, in other words, bringing people back with the face to the way they were, or having the skin drape nicely. With the nose, there is you can actually change the contours, so that's good. And then you've got, so at the end of it, it just looks like they've had something, they haven't had anything done. But then there's glamorizing, where you take somebody beyond that to look like they've had work done.
Yes.
And
sometimes very obviously.
Yeah, and I don't do that. I know there are some excellent surgeons that do that. And I think it's not something I'm going to go into. I've been at this for a long time now and I've sort of developed what I do. I mean, I do change all the time to try and get better at what I do, but I don't go for the glamorized look. I've never been somebody who people would seek out for that. So that's an expectation thing again, is that somebody would understand the expectation of what they're going to. And if my perception is I'm not going to meet their expectations, then it's not going to end well. So they will finish up seeing somebody else probably.
I have had patients who've had that more extreme result with a rhinoplasty, and post-surgically they're actually almost embarrassed post photos. Like, it's a really long time before they become very comfortable because it's a completely new look. I don't know if you remember Jennifer Grey from Dirty Dancing. I mean, her rhinoplasty disintegrated her whole career.
It did. It did, yeah. She changed it. She also had an old style rhinoplasty, which was problematic and that became very narrow here.
Okay.
And these days, I don't think her rhinoplasty would have probably destroyed her career as much. I mean, her nose was quite distinctive in Dirty Dancing, wasn't it?
Yes.
And was part of it.
And she was very beautiful.
Yeah, and even after a rhinoplasty, she was, but it did change. And to me, when I look at that nose, it looked like an operated on nose. But to be fair, that was done in the 80s.
Yeah.
So, rhinoplasty made a massive change probably in the early to mid 2000s. Probably second half of 2005, 6, 7, and 8. People like Dean Toriumi from Chicago, Wolfgang Gubisch in Stuttgart. They were changing the way people were with rhinoplasty to make sure that there was no legacy as time goes on. Because we used to do rhinoplasties, back 20, 25 years ago, and it was basically in Caucasian rhinoplasties, knock the hump off, lift the tip up a little bit, and people looked great for a while they still had swelling. But as time goes on, they couldn't breathe.
Okay.
They had issues with the narrowing, and they had issues with sharp edges and a narrow here, like a normal nose is widest here where your glasses sit, not narrowest.
Yes.
So you want it to be the widest, and so there's a return to that. And then more recently, there's been a more glamorized nose, which I think is what you're talking about with, the low dorsum and the upturned tip.
Yes.
Which is very popular in probably Turkey mainly.
Very, very popular in Turkey.
Yeah. They sort of go from one extreme to the other almost, really. I mean, those surgeons are excellent surgeons. And to be able to achieve that time after time is great. And if the patients like it and they can breathe well, and often these things settle down, they don't look as extreme as they did when they first did them. So,
sure.
But,
I interviewed Dr. Michael Callan last year in New York, and he was talking about necks, and he said that even after the last stitch in the neck, the patients return for the neuromodulators. So let's talk about the neck. It's one of the most common things I hear women complain about, and sometimes men. Talk us through that.
So the neck it's almost, amongst facelift surgeons, it's like the Olympics of the neck, right? Trying to get the best neck. Who can get the best neck? And I guess there's been some people in the world who have been highly influential in trying to get a great neck. People like Tim Martin in San Francisco is probably one of the main ones. And we realised that it's the position of the hyoid bone, which is the bone at the back here, which is above your Adam's apple, that determines where your neck finishes. So if you've got a high hyoid, you'll get a Cleopatra type neck. If you've got a low hyoid, you get a more obtuse neck. But then between the skin and those areas is a bit of fat, and also on the sides, submandibular glands. And as we get older, these things tend to get a little bit laxer, and we can maybe accumulate a little bit more fat. So that's for the people with full necks. And then there's also other people who haven't put any weight on or anything like that, who have got the extra skin. And then there's the people with the bands, the tight bands. And I guess the treatment for all of these is a little bit different. It's a contouring exercise. Doing the neck's a contouring exercise. It's not a tension exercise. So when we tried to tighten the neck just by pulling from the side here, they all failed, just about. It's like, threads in the face. You put them in, they eventually fail.
That's a whole nother episode.
Yeah, they just sort of descend. So tension doesn't work. We know that tension doesn't work, but changing the contour does. So with the full neck, what we do now is we try to change the contour. So we work out where the excess fat is, if there is, and then we contour that to give a much more gentle concavity to the neck. But a good neck is a smooth neck as well. So you can't just go in and liposuck it completely without being aware that you need to leave a carpet underneath to keep the smoothness there. So I'm sure you've seen people who have had oversucked necks where it's woody and hard. So that's not beautiful either. So what we want is a smooth neck with the contour correct. The bands are a little bit of a different situation, the bands in the neck. So if you've got this banding, disconnecting them from the skin will help, because they tend to accumulate. The skin tends to accumulate. They all tend to get in a bunch. And then if you can disconnect them, they can spread out again, and that will help. But some people will continue to get them. Some people will divide the platysma here. Some people will tighten it in the center, and some people will put neuromodulator in, like as in Michael Caine. I mean, Michael Caine, I've known him for 25 years, I guess. He's one of the guys that really sort of popularized using toxin as a cosmetic treatment and so forth. So he knows a lot about it.
He does indeed.
He does, yeah.
So one of the biggest areas in non-surgical is lips, of course.
Mm-hmm.
There has been a plastic surgery procedure that's been done forever, and that is a lip lift. Can you
Yes.
talk us through that?
So lip lift is an operation that does one of two things. As we age, and I mentioned Val Lambros earlier talking about losing volume around here, is that we tend to lose volume under the nose and it sort of shrinks up in there and the lip also gets longer
Mm-hmm.
and the nose sort of sinks a little bit. So the other thing that happens is, as we get older is that we lose lip show and we lose the volume in the lip and it tends to roll in a little bit. So we need to address those two things because a long lip is usually associated with age.
Mm-hmm.
I mean, some people are born with long lips and some people have, skeletal excess in the vertical dimension that may need one of our maxillofacial colleagues or any other surgeons that do that sort of work to shorten that. But if you've got a longer lip, a shorter lip in the vicinity of, the millimeters on the stretch I usually measure is somewhere between 18 and 20 mil on the stretch, although it depends on the person's face a lot. If it's longer than that, then shortening the lip may make a lip appear more youthful. The other thing is the lip show is whether it comes, how much red you can see. So as a rule, we want the lips to be 1/3, 2/3. The upper lip's a little bit less volume than the lower lip. Normally the lower lip looks a bit fuller. So to get more lip show, there are two ways of doing it. One is you can add some volume in there, which has been done with fillers, of course. But usually the fillers, it doesn't look quite normal because it often doesn't sit in the right spot. And it can make them shelve a little bit, which doesn't look great. So a marginal lip lift, which is just taking a little strip of skin out along the edge, will roll the lip out. The other one, to shorten the lip, is taking a little bit of skin out at the top will just shorten the lip without changing the show too much. So it's a balancing act. And often the center of the lip looks pretty good, but people fade out too much here. We should fade out a little bit here, but people fade out too much here. So you may do a combination of lifting this part here, at the upper part, and the lateral part, the part out here. You may do a marginal lip lift there. Because the central lip lift, which is done under the nose, doesn't tend to lift the sides much. So you may need to do something differently to there. And you don't want to do it excessively. It's just a shorter lip, but it certainly enhances a facelift. And people will have it done independently if they've got an independently long lip.
Are younger people, sorry, I'm going to do that again. Are younger people coming through asking for lip lifts more commonly now?
They are, but it's got to be for the right reason, of
Sure.
course. I did a woman yesterday who had a lot of filler in the past.
Oh, wow.
And she had some permanent filler, unfortunately, put into her lips and it became infected and she lost a lot of volume when we drained it and she had a lot of problems with it. But then it left her with a grossly depleted volume. And she wanted something done about that. So we changed it a little bit by just adjusting the amount of lip show she had, adding a little bit of volume and shortening the lip a little bit. It's a multifactorial thing of trying to add a little bit of volume, change the lip show and lengthen the amount of, or shorten the amount of lip that's visible between the nose. The other thing is having an acute labiocolumnar angle. In other words, the angle between the nose and the upper lip. If that's too deep, it makes the lip look too long and it makes the nose look too long. Just by adding a little bit of volume in here, you can change the perception of lip length as well. So is it true lip length, or is it something that appears that way? And it's important to see somebody who knows how to tell the difference because you don't want an operation that you don't need. So sometimes just adding a little bit of volume under here makes all the difference and shortens the lip.
You famously said on stage, because I heard it at a conference, you discussed permanent products. Can you remember what you said?
Permanent problems? Was that?
No, something about a dog.
Oh dear. Oh, yes, that's right. Yeah, well, the question is people injecting permanent products
Yes.
normally say they've never had a problem, as do people who say their dog's never bitten
Exactly.
before.
Yes.
But once it's bitten, it's bitten. And that's the problem. You must always be aware of the fact that permanent fillers do lead to permanent problems. And just because people have been having it for a long time doesn't mean it's not going to cause a problem. So, yeah, that's true.
And in terms of if it was a permanent problem, it would be a surgical.
Well, it can be a surgical nightmare for some of these things because you can't get them out.
Right.
Some of them you can sort of wash them out, dilute them and stuff, but they tend to get caught.
Right.
And they get stuck in there and it's really hard to get them out. And if they get infected, then you've got a foreign body in there which is infected. And foreign bodies, the first thing about infection is to remove dead material or foreign bodies. And if you can't remove it, these infections can be very difficult to eradicate.
It's really
and that's the problem. At least with the hyaluronic acid fillers, we can dissolve them as a rule. And they do get infected occasionally. It's rare, but they do get infected. But at least we can drain them and then dissolve them, and at least the problem can be resolved that way. But with the permanent ones, it's a difficult thing. I personally would never have anything permanent injected in.
No, either would I.
It's too, the risk is too great. Now, look, there are a lot of people who do it well and haven't had any problems so far. And I guess if they're injecting them in a bolus, for instance, in the nose, where if it did get infected, you could get at it and get it out, then that would probably be acceptable. I mean, it's not for me, but some people do it. But if it's in the soft tissues of the face or in the lips, that's really difficult to get out. At least if it's in the nose, it's in a plane that you could get it out and probably solve the problem. But in the soft tissues of the face, it percolates through. It's like a sponge, and you know, imagine trying to get sand out of a sponge. That's impossible. Like if you injected sand into a sponge, it'd be stuck in there. You'd never clean it out.
Sure. We're living in a time, it's 2024, people have never looked better for their age. Can you talk us through the aging process and what actually is happening?
Well, I can talk about it. The dermatologists are better off talking about the skin aging process, and I won't even presume to step into their area because I would do it not very well. But from a point of view of descent, we're walking around on a planet which has gravity, and unfortunately it has an effect. I'm sure if we lived on the moon, well, those people who are going to eventually settle on the moon won't age as much. I don't know what's going to happen with them.
I'm buying my ticket.
Great news, yeah. We might not be us, Alex, but
yeah, maybe not.
Maybe you, but certainly not me. Is that gravity does tend to take a toll and things descend, but it takes more of a toll in certain areas than others. The side of the face here is really stuck. It doesn't move much. The front of the face here is really stuck. It doesn't move much. But this column here down into the neck moves quite a bit. And this is the area that we concentrate on. So it's this area of the face here, the lateral brow, this part of the cheek, which gives you the nasolabial fold, which gives you the marionette line and gives you the jowl, and then you get the confluence of everything in the center of the neck. So it's this column here that ages. So this part doesn't move much and this part doesn't move much. But we have to get access to this area in certain ways, and that's why we go from the side in a facelift, because we don't want to put the scars somewhere where they're visible. It's good news for people who inject, because if we're trying to change the contour of a face, it's the face is flat here and fairly flat here. I mean, except for the nose. It's the transition point between the side and the front that sort of determines how a person looks, really. And so we can change a little bit of that by adding to that area and changing how sharp the contour is changing. If we add stuff out here or to the front, it doesn't always look as normal as it does. So, but this is the area that ages, and this is the area that we address in a facelift. So you have to address the lot, I think. People ask, can I just have my neck done? Well, you probably could if you're quite young. But the trouble is that residual that I was talking about, you really can't, because you've got to take the wave out. And if you don't take the wave out, people finish up with bunching here. They finish up with strange smiles, you know, and the direction of pull is important when you're redraping the skin, because we all know the legacy of the lateral sweep in facelift looks terrible, where people look like they're going out this way, or there shouldn't be any of this. It should all look normal. So the whole idea is everything goes up and out, not in one direction. And that usually reverses those aging issues that we've seen.
So we're aging, we're dealing with bone loss, we're dealing with muscle, we're dealing with fat, and we're also dealing with skin.
Yeah.
During a facelift, are you replacing the volume with fat?
So I do. I do a fat transfer in just about everybody, because I think they do lose a bit of volume. There is a bit of controversy as to how much volume you lose. I mean, is it just being displaced and moving down there? So a lot of the people say, well, when you move it back up the face, and that's true to a certain extent. But I think adding a little bit of volume makes a difference, particularly a little bit here and a little bit at the base of the nose. I think that makes a big difference. And also maybe a little bit into the marionette line. That's the main areas that I add it. So we're adding volume. I don't add volume to bone. However, I may involve one of my colleagues to do perhaps bring the chin forward or something like that in people who are chin deficient, because you can't get a good neck if somebody's got a very deficient chin.
And would they use an implant or hydroxyapatite?
I don't use implants. We tend to use a genioplasty.
Okay.
You could use an implant and you could use hydroxyapatite. They're the other ones, but we tend to use just the person's native bone, because the thing about that is it brings the muscles forward with it when you do it. So they're still attached. So that helps. With an implant, you have to strip all that and then put the implant in. But I think they're both fairly effective. It'd be difficult to tell which was which. So people like Brian Mendelsohn add volume to here using hydroxyapatite to give a firm plant, and he had a lot of success with that. I don't do that, but I do add the fat. So so it's another one of those things that we do on a facelift. As I said, it's multiple things. A little bit of a lot of things always looks better than a lot of one thing.
Sure.
Right? Like if you're cooking something, you multiple ingredients, but you don't add more of one just because you think it looked good. Like, it's like, Panadol. 2 Panadol's good, but 4's not better.
No, it's not. Absolutely not.
So we try to do a little bit of a lot of things, makes people just look the way they should look and not look in any way abnormal. They look normal.
Why do you think people perceive plastic surgery as unnecessary?
Well, I think it's probably more the cosmetic side of things that people have a bit of an issue with. But I think it brings us back to, what is medicine for? What do we treat patients for? Why do we have medicine as a profession? And people will say, oh, well, it's to cure fixed pain, it's to cure cancer, it's all, and all that is part of it. But the big thing that we do that probably underlies everything is to improve the quality of life of the patient. Now, certainly people with severe illness, you've got to improve their quality of life, but it may not mean curing them from that. It may be relief of pain, it may be improving the way they interact or something like that. So where does cosmetic surgery fit in? Cosmetic surgery fits in because it changes people's quality of life and the way they perceive themselves. It is important that I think it's realised that it has a very important place in that, and people see it and do it because of that, and that's why they go ahead with it. And overall, the satisfaction people get from this and from what they do. That's why we do it. And it's some of the most rewarding things that I've done. And, I've done everything in plastic surgery in the last 25 years, but this is probably the most rewarding part of my career, I think. So as long as we as long as we realize quality of life is at the basis of everything that we do, I think cosmetic surgery has a great role to play.
I often ask my guests this question: how does someone like Dr. Peter Callan get better?
Get better as in?
At what you do?
Well, two things. I would think that my great gift is being able to copy.
Okay, that's a great gift.
Copy the best.
Yes.
So I look at everything. Like, for instance, some of the people like Brian have been a great influence on me, but Tim Martin has been a great influence on me, and people who, but I don't do what he does.
No.
It's his concepts that I love. Everything is the concept of the way these people think and their way they're trying to make the face look as normal as possible and as rejuvenated as possible, and with no legacy issues, so as people don't know that anybody's had something done. I mean, they're the things you strive for in your practice, and, you know, God forbid, minimal complications.
Yes.
So, yeah, copying is the thing that I've done over the years. I look at the way they operate, I look at the way they hold their hands, where they rest them, how they pass things, you know, even down to things like that, how they dissect the tissues, where they dissect the tissues, the directions they move tissues, and how we what their concepts are of not exactly what they're doing, but what they are trying to achieve. That's how I have changed my practice over the years. So, you know, I get influence from people, and I don't do anything that they do, which I think means that they're able to transmit their philosophy well.
Well, thank you very much for joining me today, Dr. Peter Callan, on another episode of The Face.
It's been a pleasure, Alex, and thank you for the invitation.